why don't we leverage what we've built and create an optimized opportunity for a health plan of the future? So VālenzONE is going to be our fully integrated opportunity for you to use stop loss, all of our rewards and member engagement experience tools, leverage our contracted and non-contracted network design, leverage all of our cost containment clinical solutions, and allow us the opportunity to help you create a better member experience for the right self-funded, self-insured employer.
Thanks for tuning in to the Self-Funded with Spencer podcast. Let's go make healthcare better together. I think hearing the story of this company would be useful for the folks that don't know the full background.
Yeah, I love that. And thanks again to Spencer for coming to Philadelphia, right?
Yeah.
Coming out here and spending time. And those that don't see him, but Nathaniel is here with us too. And he's just phenomenal to kind of guide us through this journey today. So if you start with what is here, right? What are we today? So 3 parts, again, a continuum, and you'll learn I'm all about threes, right? It's a military thing actually with the Marines is 3, chain of command, everything. And so I've adopted that many years ago. But if where we are, let's start with here. How we got here would be the past to the present. And then we can have this fun conversation about the present to the future. And so what is here? Vālenz today is, ironically, about 585 employees, is a fully integrated suite of cost containment and related payer and provider point solutions that allow us to help employers and members identify the right course, the right touch point for care at the earliest possible point in their journey into healthcare. And we do that both in a point solution basis, if you want to just use one of our solutions, and then in an integrated suite of. So it can mix and match, so to speak, Garanimal style, right? You can pick tigers and bears. And so that is where we are today. We do that successfully today for a wide audience of market, employers on a direct basis, third-party claims administrators, stop-loss and risk-taking entities. We actually work with health plans. We actually work with insurance carriers. So we work wide swatch inside the commercial group health insurance space, principally aimed at self-funding, but some of those groups have us tagged with fully insured types of products. And so that is who we are today. How did we get here?
Yeah.
Back in 2018, when I first started with the company and stepped into the organization, we were, I would say, a group of loosely affiliated acquisitions. Right, so there was an initial investment in a base business known as United Claim Solutions, which is out-of-network negotiation business. There was an acquisition of a care management business known as Inetico down in Florida that brought us our case management, disease management, and utilization management components. And then we acquired a technology business, a SaaS business out of Ohio, known as Zebu Compliance Solutions. What's really cool about that business is it balanced our act. That business was both payer and provider side. So helping providers bill properly, teaching payers what to look for in billing, helping providers get licensed, have their licenses and networks get licensure monitoring, credentialing, and then confirming for payers that a provider didn't have any license restrictions. So really kind of a balanced business, a tech business. And so when I joined, and then we also owned a business that was a startup called NX Health Networks, and that business was a small, high-performance network contracting business, which we expanded for quite some time until we've now consolidated into everything that we do in the access component of networks for Vālenz.
Can I stop you for a moment there? What was it about those 4 businesses to start to be the foundation for what we know today?
Great question. When you looked at what we were doing, we were principally participating in distribution with third-party claims administrators. So we were primarily a TPA point solution partner. And what was interesting is we weren't necessarily doing all of those things for the same TPAs. So I could be working with Spencer TPA and just doing out a network negotiation, and I could be working with Nathaniel TPA and doing case management. And I've never, at that moment, we had not crossed over to say, well, why don't you use more of our solutions? Our customers actually were coming to us in the early part of 19 saying, I'd be interested in learning more about the other services. because I'm buying them from multiple parties. And while the phrase hadn't become widespread, it was emerging. Point solution fatigue, right? This whole idea of, man, this is hard. Technology is making it really difficult. And so I got to interact, I got to integrate, I've got to build EDI, I've got to test EDI, I've got to maintain all of this technology infrastructure for 1, 2, 7, 12 different vendors that are kind of aimed at a point solution piece, but not the full spectrum. And so we decided we were going to become a platform and a chassis, two different things that come together. So a chassis meaning we could layer on top, a platform meaning we've integrated it all. And we are going to go buy, build, or partner the stuff that makes the most sense for a payer to come to one place, one throat to choke, so to speak, and say, I'm going to give this all to you.
Okay.
And so that was kind of the early foundation of what we're trying to build.
Well, and did the original vision of putting these pieces together to build the chassis that became the platform, was there an intentionality of where the company was supposed to go, or is that a lot of what your involvement has now interjected into the equation?
So I think at the time that I joined, it was, let's do more stuff for our customers.
Okay.
I think that's still a bold goal, right? So I don't think there was anything wrong with that. The challenge was there wasn't clarity of focus on where could you take it beyond that.
Okay.
So doing more for people is honorable, but doing it in a way that then advances them forward to something, right? Spring forward to something that you see on the horizon, that's special. And that's what we wanted to do. So we had all these phrases, right? Vālenz has its own vocabulary list. Like, you need a dictionary to understand all of our words. So we have aspirational and perspirational. It's exactly what it sounds like. This is what we want to be. This is what we do today. We aspire to be this. We sweat this every day. And so in the early stages of where we were going to go next to get to where we are today and advance forward, it was with this understanding we're going to be over the tips of our skis most days. We are going to be more aspirational in what we're talking about than actually executing perspirationally against it. So when we were talking about where out-of-network negotiation was going to go and what that might look like and where RBP was going quote-unquote wrong or misaligned, how could we improve that? And then let's talk about what we're doing or going to do as if we're doing it today. So when you want to become, you have to be. And that was the whole idea, was we want to become this broader spectrum, more professional organization in the space that sees the opportunities and seizes on them to be that today. Well, when you do that, your talk is more aspirational.
Yeah.
It's not what you're doing today that you're talking about. That's the what do they call that? The table stakes?
Yep.
It's what are we going to go and how are we going to get you there? And so thus was born Wayne Gretzky's dad, go to where the puck's going to be.
Yeah.
And so we adopted this. We're going to talk about the future more than we talk about what it is we're doing today, because we want people to give us ideas on what is unmet and underserved so we can solve for it. And we're going to treat that as if you're not ready to be there today, but I'm going to make sure that I've established myself in a position where I can take you there easily. And so when then you look across, and for those that did visit the first portion of our conversation today, and they see all the wall placards, they'll then understand where Simplify Healthcare comes from as a vision, right? So it was really this idea of how do we make it easier for everybody? It's complicated, it's messy, it's convoluted, it's not integrated. People don't really share data very well, and when they do, it's not good data to use. And so how do we simplify that and make it behind the curtain? Everything works.
Chronic health issues, surprise out-of-network medical bills, inflated medical and prescription drug prices. These issues cost self-insured employers hundreds of millions of dollars every year. Add to this the rising cost of care and potential for waste across the life of a claim, and it's clear that self-insured employers need innovative solutions that lower their health plan spend. At Vālenz, we've done just that, developed innovation that shifts the current paradigm. A complete and integrated ecosystem solution driven by data, one that manages and simplifies the complexity of medical claim costs. It is through analyzing millions of data points that we enable employers to realize and fuel cost-saving solutions. Vālenz experts come prepared from day one, targeting the fraction of claims that will drive the majority of health plan costs. That is how our team lives the Vālenz promise, engaging early and often for smarter, better, faster healthcare.
So when did you take the helm? 2000.
December 10th of 2018.
Okay. What attracted you to the business?
So, which is a big word for me. We talked about that earlier.
Yeah. Filler words, right?
It's a fill word.
Yeah.
It's a fill word. I think it's appropriate here, though. It's a great lead-in. My career is what led me to this. So take a step back. And my wife, who's an active part of every conversation, as you know. Karen shows up in every conversation. All the good in my life is a function of her kind of making sure I do the right thing. And so in my career, I have made changes consciously to learn and grow and do something I haven't done before. So when I left accounting to go into healthcare, I did mergers and acquisitions of physical therapy. Then I had an opportunity to lead an organization inside of a very, very amazing company known as Corvell Corporation. I was there early. Where they've gone today is just spectacular. But I had the good fortune of running a business inside of a business. And so that taught me how to think differently, P&L. And then I had the opportunity to go and lead a business that was in the independent medical evaluation business. And then from there, I went back into corporate, but I led sales. And then I got to lead M&A, and then I got to lead corp dev. And then I got to lead a risk management division inside a TPA. But it was all in the property and casualty commercial side.
Okay.
So when this opportunity presented itself, and I was debating if it was time for me to look for something new, Karen was like, "You have to take it." I'm like, "But I've never been in commercial group health. I've never done that. This is a whole new world." And she's like, "Yeah, and that's why you're going to be successful, because you're going to grow, you're going to expand, you're going to force yourself to be an expert, which you're not in it today." And so that was what the attraction was, and the opportunity to transform something that clearly to me appeared, and now I know it to be true, broken. And I don't mean that in an ugly way. I don't mean that in a mean way. I don't mean it, there are plenty of people that have solved healthcare, but they really haven't.
Yeah.
We talked a little bit about that off camera. And I don't know that we're going to solve the healthcare problem, but we're going to make it better.
Yeah.
And I want to fix it.
I don't even think it ever could stay solved, because it's an ever-evolving marketplace, right? And I think we constantly have this conversation. I think Dave Contorno is one of the ones that's like very prominent in saying this. It's not actually broken. It really depends on the vantage point that you're looking at it. It's certainly fixed or working correctly for certain stakeholders in the equation, right? And so depending on your perspective, you perceive it to be broken or it's working exactly as it's designed. But I'm with you, though. I think we're in a point in 2025 in the healthcare landscape where it is transforming before our eyes, and there are folks like you who are very actively participating in the transformation of healthcare.
Yeah.
I don't know if you want to call it a 2.0 or a 3.0, but we're going through a shift in healthcare. And so I wanted to tell the story, and I want you to have an opportunity to continue to tell the story that gets us here today, and then talk about what Vālenz is today, and then of course we'll fit in with what's going on in the future.
So, shades of Karen, you're perfectly designed for the results you're getting.
Okay.
So healthcare is designed in a way by key stakeholders who designed it, and they're getting exactly what they want from it. The problem is there are more constituents and participants and key stakeholders that are saying, it's not working for me. So you have this friction, right? You have this inflection point that has occurred. It's been going on for some time. And I think it's interesting because we're in that moment where widespread adoption of change hasn't really happened yet, but it's going to reach acceptance.
Yeah.
And so I think that's kind of the final stage. When you start to see wider acceptance of things, so RBP is a great example of that. I don't know when it originated, but it started as an idea that then, had some curiosity around it, that then became some sort of adoption, that then moved into widespread acceptance. And in its moment from curiosity to adoption, different versions of that idea begin to manifest. Everybody's doing it a little bit differently. How you bill for it, how you charge for it, how you set the table. As it got widespread acceptance, the spilled milk within the models began to become more prominent. So now it needs innovation. Now it needs that enhancement or next step. So what are the things that are unmet, underserved, or problematic in that model, and how do you fix it? And I think that's where we are, generally speaking, in healthcare today. I think in this world, we are realizing health insurance is not healthcare. Health insurance, right? If you think of insurance, you and I have talked about this before, and I spoke with others about it. I insure my car, and I have an accident, unless I did something really stupid like I was drinking and driving, I'm probably not going to go bankrupt. I'm not going to go to jail. If my house has insurance, I'm not going to lose my house because something happened. That's what insurance is. It's to protect me. But healthcare insurance is like a funding mechanism for access to healthcare.
Yeah.
But the cost of the healthcare, all of that has shifted. The burden of spend has pivoted. And now we're in this moment where 65 or some ridiculous number, 62 to 65% of all bankruptcies are medical debt related, and apparently it jumps to like 85 or 90% when you incorporate the number of people that take out a second mortgage or finance healthcare, only for that to blow up as well.
Yeah.
And it is a ridiculous percentage of that 60% that are there, like 75 have
Insurance already.
insurance.
Yeah. Well, so let's continue with your analogy, because I think it's a worthwhile one to step into. Let's look at homeowners insurance, right? A homeowners insurance, at least where I live, is already pretty expensive because we get a lot of hail, right?
Yes.
And what I'm insuring for, obviously, is mostly I need to get a new roof every 3 or 4 or 5 years in Texas because of that. And then there's also loss of the house itself from a fire or something catastrophic. Imagine, though, I had to pay enough premium to also use my homeowner's insurance to pay my utility bill, to cover my lawn care, to cover,
Yes.
I need a new fence or whatever it may be, put some new bushes in the flower bed. That's what we've done in health insurance. My health insurance covers every single interaction with the healthcare system. And when you over-insure every component of that, obviously the premium goes up. How much more would my homeowner's premium be? It's already high. How much higher would it be if I used it for all those other things that are not supposed to be insured because they're not catastrophic loss of use? They're simply just, hey, this is part of owning a home.
That's right.
I think going to the doctor and paying cash for labs or paying cash for primary care seems relatively obvious. Even if the employer is the payer in that situation, why would you insure that type of interaction? Because that's not what insurance is for.
100%. 100%. So I think that's the inflection point, right? This is the moment where we're starting to catalyze all of that and realize as a group think it's time for change. And so now what will emerge are ideas. And those ideas will gain traction and create curiosity about, well, could I do this and could I do that? And I think I think we've moved beyond curiosity now to people willing to adopt new ideas. And it's evident in some of the noise. I've never met her personally, but Chris Deacon is one of the most prolific voices in our space. Her ability to identify and share what's going on with these antitrust and fiduciary lawsuits. Like, I don't know what the outcome, so thank you to Chris Deacon. I've never met her, but when I read her stuff, I am illuminated by what's happening in the space. And I say to myself, not all of these can end with the big guys winning. At some point, one of these is gonna stick. And we're gonna see action as a function of that. People are gonna be forced to reckon with, this is not working. It's not working. So back to the Vālenz journey, that was part, believe it or not, that was part of the underpinning. Was to recognize that this was not going to work for the member, and we started to create the 4 Ps, the payer, provider, patient, and the plan. So the payer could be the TPA, whatever. The provider is obviously the network and or the medical provider or the system that you're working with to adjudicate and administer care. The patient is the employee or the member. And or their dependent. And then the plan is really the employer, right? So we said, how do we try and create balance and alignment? Those 2 words also are kind of core to Vālenz. How do we create balance and alignment in this system where you're balancing a cost, quality, utilization equation and you're aligning the 4 Ps, payer, provider, patient, plan, in that equation so that everybody feels heard? Because that was kind of what was broken about RBP as an example, is the provider didn't feel like they had a voice. The member didn't understand what they were signing up for. The employer probably wasn't aware of how much friction would exist. So there was disconnect, right? There was discontent, disconnect, and misalignment in understanding and incentive. And so how do we fix that? So we came up with solutions to try and address that. And that's what they manifested as. So as we were going through this journey in early 19 and thinking about how you put this together and how you platform chassis, a point solution, a brigade almost in the space. Bless you. You okay?
Sounds great. I just felt it coming for a second. We'll cut that out. Go ahead, please.
No, that would be good. as you looked down and started to realize what it meant to be a point solution platform in early 19 is when we realized, okay, to become one and one Vālenz, we're going to need to become Vālenz 2.0. Okay, so Vālenz 2.0 needed to be named. At that point, we were a family of companies of 4 logos, and it was time. And so we talked a little bit about this earlier. That's where we began to realize, hey, it's important for us to have one brand, one identity, one culture, one set of values, one set of strategic imperatives, and this whole idea of what is our North Star as a business. And so our North Star became our brand promise. Engage early and often for smarter, better, faster healthcare. I know that many people think that their mission is their North Star. It is. For us, we created the mission out of the brand promise. We realized that we were here to be strong, vigorous, and healthy, as our Latin translation of our name connotes. And we were here to engage early and often for smarter, better, faster healthcare. And so the whole idea of that was, how do you build this architecture for the member to come to you as soon as possible and engage with you in understanding what's available to them in their healthcare, what their healthcare journey could look like, and how can you inform and guide and direct them to have a better member experience, right?
Pareto Health is the largest benefits captive in the United States. With nearly 3,000 captive members, 1.3 billion of stop-loss premium in force, and almost 1 million covered lives, no other benefits captive comes close to Pareto Health's scale. But it's not just about the numbers. Pareto Health is a mission-driven organization, and that mission has 2 distinct parts. Number 1, to make self-insurance simple and more accessible for small to mid-sized employers. And number 2, to arm them with the most powerful cost management tools on the market. So if you're an employer frustrated with your healthcare outcomes, or you're a benefits consultant looking for an alternative to the status quo, it's time to consider Pareto Health. Pareto Health, where employers come to do self-insurance right, to do it easily, and to do it at scale. Well, the engage early and often, I think, is really crucial that I want to double click on. Most of healthcare, what we think today, is sick care. Most of it is reactionary to an acute situation from a chronic disease of some sort that's manifested over a very long period of time. When you engage early and often, and you want to be strong, vigorous, and healthy, that means you have to meet members far before that catastrophic situation arises, to hopefully even prevent it from ever arising, right? And so I think a lot of times we equate healthcare to just after something happens, not how do I prevent that something from ever happening. And so I'd love to hear how you guys are involved in the engaging early and often piece.
Yeah, so it's 2 parts. We've created what we call the claim cost arc. There I am using my hands again, right? But the arc, as we've talked about, is intentional. Because if you don't manage it and get closer to the front, what ends up happening is on the retrospective phase of spend, you're no longer coming down. You're going to watch it go up and to the right. And that's what we're seeing, right? We're seeing a lot of that happen. In our world, the first early engagement for us, prospective, was just helping members understand their network. So the early phase was a product we called Navigation, NavCare. And NavCare was just helping educate members with TPAs as partners what their healthcare options were inside their health plan, and what were the things that they could utilize to help them get, lower cost care for their needs. Yes, and it was more than that. You said, we've got to get that member experience, and then you need the app, right? So we partnered with somebody, and so we have an engagement app. So now we're touching the members sooner. But now we're going to get to open enrollment. Right, so the real magic is going to be when I'm sitting in front of you as you're making your selections for what you're going to use for healthcare this year, which plan you want to use, etc. How do I help you as the member in that early engagement and get you in open enrollment to understand what's available to you? And what's really interesting about that is, you know this, I go to the doctor maybe once a year. Like, if you explain to me something in September of what I then make a selection in October for my 1/1 renewal, and then I'm first going to the doctor in July, how am I going to remember all? That's almost a year from the moment. And I consider myself pretty educated in healthcare, and I still don't understand all the details, right? And so the way that we're looking at this, and the way that we acquired Healthcare Blue Book, now known as Vālenz Blue Book, they were doing this. They were spending a lot of time, regular real time, with a team that does member engagement. And it's not member engagement inbound, It's member engagement outbound. It's reaching out to members and explaining to them what their benefits are and what their opportunities are, and that they should be calling and finding out the cost-quality equation. They should be calling and understanding what surgical bundle and COE options are available to them before they make the choice to go to the doctor, before they make the selection. And so that is how we're looking at engaging early and often, right? Could you do more? Absolutely. If you could get to the plan, which is another thing we're trying to do, and get to the employer and say, before we open enroll, let's talk about what your goals are for your health plan. Let's talk about what your goals are to work with an employer about recruitment. Like, do you want to use benefits as a vehicle to recruit and retain? What are the types, right? So you have to get that curiosity muscle kind of active and exploring what the future looks like. Because I do think that at some point, if we create a healthier workforce, the discussions we're going to have about healthcare coverage will become different. Because we're not talking about sick care anymore. Those truly do become the exception cases.
Well, I do think that's the paradigm shift that's going on right now, Rob, is we're actually talking about, even at a national level, how to create healthier humans and healthier Americans. And I have not in my entire life experience that type of public narrative happening, whether it's politically or whether it's in the corporate world, where it's like we all recognize how just fundamentally sick the majority of the population is. I've heard the most recent stat is 74% of the population is overweight or obese. That's an insane number. That's 3 out of 4, if that's fully true. And so I think we have this whole, all of us in the healthcare space are going, yeah, I know how to manage risk, or I know how to manage a claim, but you know what nobody's really been talking about for a very long time is how do I make a healthier human being that has to interact less with the healthcare system, or less often in a dire situation versus a proactive situation.
100%, and it's interesting. So obesity is a great one because there's a word called cardiobesity, and obesity leads to cardiac issues. It also leads to diabetes, which then leads to other types of healthcare related. And so if we would just attack obesity and what's causing it, right? And teaching people, look, I don't want to do anything to hurt a brand, but there are restaurants that are serving unhealthy food, and they're promoting them as healthy and they're not. And as a function that Americans are buying stuff and eating stuff and ingesting stuff, just not good for you. Just not good for you. And so, you know, I think, you know, I'm a plant-based person, but I modify. I've added fish because I need to find protein sometimes and I can't get it everywhere I am. So I've modified it to add that. My wife recently said we should go back to eggs potentially because that's a good source of protein, and those are going to potentially. So I'm
going to agree with Karen on that one.
Yeah. So we went back 2 weeks ago. We started adding eggs. We're still plant-based. We don't use butter, right? But we're adding eggs back. We're not eating meat. And so I think, and to your point, everything is evolutionary. Right? So there's not one way to do something. There's many different ways to advance it forward. And that's the big word for this year, as you and I talked about earlier, and I'll get into that as well, as the foundation of Vālenz. And so we're good examples of, we started out as pure plant-based, but now we're modifying and recognizing there are things that are still good for you and can help you that might not fit the profile of just being in that swim lane.
Well, I think also sometimes people, you start to want to live up to a label. When you say I'm a vegetarian or I'm a vegan, now you've created an identity around a thing that you do, and you sort of transfix or affix yourself to that identity, and you can't modify it as needed, right? And so I avoid, people ask me, well, are you carnivore? I'm like, no, I eat quite a bit of meat, but I'm not this like rigid zealot adherent to I am this thing and I do this thing. I may be the foundation for what I do, but I continually modify and perceive how I'm feeling, and new data comes in and you adjust results from that data. And I think people probably shouldn't be so rigid in creating an identity around something.
We are, so I love where you're going because we're moving a little bit of a tangent. We'll get back. But there's labels, right? Labeling, it's like, it's so important to people. They have to put you in a category. When we were going for our business, when we were looking for new capital, it was amazing to me to watch how the sector of investment banking and private equity, how they have to put in your payment integrity. No, not really. I'm more than that. And so that was part of the reason Kelso was so unique is they kind of listened. They just accepted us for who we were and really embraced what we were trying to do and where we're trying to go with this business. And they wanted to be on that journey with us. Like they saw where we were trying to go, and it wasn't just, not everything we do makes sense in the sense that it's all intertwined and obviously connected. Like we have a provider side business that does credentialing. How does that connect the dot to what you're doing in payment integrity? It has a connection point, may not be visible, but it doesn't have to be perfect.
Yeah.
And so it's just interesting, labels and identity.
Well, I'm guilty of that myself because I'll often have people approach me, right? Obviously, they understand what I do at Pareto. They understand the podcast. And they'll say, hey, I'd love to talk to you. I'd love to talk to you about what we're doing. And if I have time on my calendar, I can make it make sense, I'll listen. And I have the same difficulty sometimes. I need to compartmentalize them compartmentalize what they do so I can first understand it. Even if it doesn't neatly fit into a bucket or a file in a file cabinet, that's fine. But I start with a foundation of like, oh, I think you're kind of this thing that I already have a frame of reference for, and then you can show me how you're a little bit different than that thing.
Yeah, and I think I am, and to the point where I think internally at times my leadership team might even get frustrated with me.
Okay.
I'm like, I don't want to be pigeonholed.
Yeah, fair.
And so when somebody says, well, we should just tell them, yeah, we're in the alternative reimbursement reference-based pricing. I'm like, no. Because as soon as you do that, you're no longer all those other things.
Yeah.
Because it's hard for people to take the time to conceptualize all these other pieces. It's easier for somebody to say, oh, you're an RBP vendor. Mm-hmm. Not really.
Yeah.
I mean, if you want to place me there because it's easier for you to understand how to think of me, but I'm likely not going to then get what I need from you to think about innovation.
Sure.
So to a fault, I will say I want to be in our own category. And that can be hard.
Yeah.
Because it's hard for people to say, well, then, but who's like you? Well, the fun part of that conversation today is when people say to me, do you really have many competitors? I'm like, yeah, we do. In segments of what we do. Sure. But in the holistic of everything we do, there aren't too many people doing what we're doing.
And I think that comes back to a conversation that I had with a gentleman a couple of days ago is this notion of, he used the analogy of like DirecTV, where we used to watch cable and you get everything through a cable box. And then there was a massive push to unbundle. And all these unbundled cutting the cord services arose. And now I could be Team Netflix and Team Amazon and Team Apple TV, or maybe I need all of them to get all the shows I want. And what's actually happened now is now you need a bunch of other things that are tangential because you want to watch NBA and you want to watch Major League Baseball, and you find yourself, you've repackaged this like hodgepodge of stuff that's now costing you more than what you left before.
Correct.
And so I bring that to say to you guys, the way I translate what you do is you have reassembled, but in a much more cohesive manner than somebody trying to piecemeal a solution together.
100%.
Yeah.
That was the whole principle of platforming a point solution business, was to create that environment where it all can work together. You could come to one place to get what you need as a payer, an employer, a broker, a carrier. And if there's something out there that's kind of single thread that you think really makes sense, use infusion therapy. I don't have to build that solution. I don't have to buy that solution. There's a great partner out there for me to work with. And I can immediately put that platform, that program, and integrate it into my platform and being distributed straight through to all my customers. So we built an environment that allowed for that to happen. That didn't exist before we did it. It's not a marketplace.
Yeah.
I'm not distributing everybody. I am allowing for those things that my customers say is a gap, it's an unmet, underserved need.
Yep.
If I don't want to do it myself, I'm going to find the best and I'm going to platform it inside my environment and chassis it up and distribute it through.
I was exactly going to say the chassis and the platform is exactly what you're describing. And so how often, Rob, are you evaluating what the customers are telling you is perhaps a gap or a deficiency or an opportunity, if you will, to bring something else to the fold?
Every day.
Okay.
Every day. I try to take at least 3 hours a week. Usually it's over the course of 2 or 3 days, and just make outbound calls to my customers. What's going on? Checking in. How are we doing? We spill any milk for you recently? What did that look like? Did we fix it? Did we solve for it? I spend time with our client services team. I spend time with our chief revenue officer, and I say, what's the market's asking for? I talk to my COO all the time. What are we doing that's right? What are the things that aren't going well? What are our customers complaining about? What are the things that are consistent friction that we can't seem to get out of our own way? And we're a good company. We still have stuff that doesn't go right. And we recognize that. And that's part of being humble, is recognizing you haven't figured it all out. We never will, right? We're gonna do the best that we can, and as soon as we fix it, something else can break. And this is what happens. But we're constantly checking with our customers and scanning the market. You know, I try to go to as few conferences a year as possible. It's not my thing. But SIA, we are the title sponsor. That has become our thing. And I spend my time in our suite, in our meeting rooms. I try to stay off the floor. It's just difficult. So I apologize to anybody who's tried to get me on the floor. You're usually not going to find me at my booth.
No, come up to the suite.
Come to the suite, or call me and I'll get you to the suite. But I want to have a meaningful conversation in a quiet environment where we can have an open dialogue and a transparent communication about, are we meeting the mark? Are we meeting the moment on a consistent basis? Because if we're not, we need to know that. I can't fix what I don't know is broken.
Exactly.
Right? If it's a lie, I can't answer it.
Yeah. Well, and so then I don't know if that makes sense, if we're caught up to where we are today in your mind, if we're missing anything, or should we start?
No, I think that's...
Let's do sort of forward-looking, what this company is becoming.
Right. So here, right, so we've gone where we were. We've had a fun conversation about how it took to get here along the way, talking a little bit about just general stuff in the space. But here now is a platformed business that has point solutions that are fully integratable, and in some cases already integrated, that allow the payers, the TPAs, the employers to come to us and say, I want that. And I want this piece of it. I want it done this way. We've got all the connectivity capabilities, APIs, EDIs, all the buzzy words that people need to hear. We've got security and all that good stuff. And so now you look at that and you say, what's still unmet and underserved? Well, the full experience of healthcare for the member is still underserved, right? Not necessarily unmet. There's stuff out there for you to use, but it's underserved. So what can we do with that? Well, why don't we leverage what we've built with Healthcare Blue Book, leverage all of the pieces of these point solutions, and create an optimized opportunity for a health plan of the future. And so that's what we're talking about here now, is VālenzONE. So VālenzONE is going to be our fully integrated opportunity for you to use stop loss, for you to use all of our rewards and member engagement experience tools, leverage our contracted and non-contracted network design, leverage all of our cost containment, clinical solutions, and allow us the opportunity to help you create a better member experience for the right self-funded, self-insured employer.
I love that. And is it eventually, or in its current state, would it be effectively an alternative or new modern replacement of a health plan? Or are there still components today that would need to come to the table alongside it?
Recognizing that change is hard, and that not everybody embraces getting comfortable being uncomfortable, I think it's going to first manifest as an overlay. I think it's going to first manifest in, let's help you with plan. You could pick the architecture of network. Here are all the pieces that you need to carve to create the opportunity for better member engagement and better cost quality utilization. And then over time, that may stick, and that might be the answer for many. I think others are going to say, I don't really need a network that's contracted anymore. And I think that's where we are headed. It's going to take time. This whole idea of I could go see any provider I want, that's not the truth, but it is. Providers don't need to be in a network for you to access them. There's a misnomer. When you see the schedules, you can see all the published data. Providers have a self-pay, which means people don't have insurance. So we have the opportunity to evaluate those providers based on readily available, publicly available data that allows us to say, here's their cost structure, here's their quality. We know what reimbursement should look like for them that they'll accept. Let's begin to work with directing of care to these types of providers.
Absolutely.
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans, and allowing them to create an environment where we ensure that the benefit plans are being charged in a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
Yeah.
I mean, I couldn't agree with you more that I think we're going to see the eventual dissolution of a network as being the way that you access care. I do think it served its purpose, perhaps, but I think that purpose is cresting in its utility. And I think with all the alternatives, the bundled arrangements, the direct contracts, narrow networks, reference-based pricing, the variety of those, at some point we have to question whether or not I need a contracted network anymore at all, or if there's preferred ways to pay and to transact. And I think the proliferation of hospital data, AI to be able to parse that data, the availability of cash pay information, at some point we would question, well, why do I need an entity, a third party, to negotiate on my behalf for reimbursement rates when those reimbursement rates are often very sky high versus the comparables? Why don't we just do away with it altogether?
Yeah, and I think, and by the way, I actually see the carriers embracing that they need to do things differently
Really?
too.
Okay.
And I think it's important that they come along with this. Like, there's a lot of anger.
Yeah.
A lot of anger.
Yeah.
At the BUCA.
Yeah.
We'll use the acronym that people use, and I think it's misplaced.
Okay.
In some ways, yes, the failures are attributable to many of the things that people talk about. But a lot of people have gotten good health care too. A lot of people have had coverage and had difficult times and had loved ones getting taken care of.
Of course they have. Yeah.
Through the system as it is today. So like anything else, it's probably reached its end of life cycle. It's the usefulness of the plan designs of the past and the way it's worked need to be modernized. And I think we need the BUCAs to help get us there.
Okay.
I think this idea that we're fighting with them is misplaced. Now, that's just, again, I will say this out loud. There will be people that will hear this and say, he doesn't know what he's talking about. You're entitled to believe that. My belief is that they are so large and control so much right now, the idea of a little tiny company like Vālenz taking down Blue Cross is unrealistic.
Yeah, yes, sir.
And I don't think anybody should expect that. But I think partnering with the BUCA models and partnering with them to say, hey, can we help you modernize this area of what you're doing in the market today? Hey, look, United's got Surest. That started out as Bind, right? And so these modernized approaches to attracting employers to a new design, they're there.
Yeah.
The variable copay designs, right? The what I call the kind of the vanishing deductible design with Remember Rewards design solution, like we're going to do with VālenzONE. Those are the things that I'm seeing everybody say, what's the variation or version of it that needs to come to market?
Well, I think most...
So just to point out, and not to interrupt, but just to point out, we're not here to bring down
Of course.
United Healthcare.
Yeah.
I'm here to help that segment see what we're doing and embrace that we can help get there together.
Well, it's almost like you're developing an alternative version of what can be done and demonstrating that capability and growing, which then attracts the attention from a BUCA to say, well, what's going on over here? And that's interesting. Maybe there are things that we need to adapt that people like. But I think the one thing, or a couple things that folks sort of take umbrance with a BUCA, and it's not any particular one, is just the opacity of the network arrangements and the reimbursement rates behind the scenes between the hospital, right? And then the other thing is the vertical integration component where they're owning a lot of the healthcare delivery and the pharmacy benefit management. And that creates some, in a lot of people's minds, a conflict of interest in the health insurance equation. And I think those are the kind of the components that get the most scrutiny that do probably need to change, right? And it doesn't mean you abandon the whole model. It's like there's just components that don't seem to jive with what individual patients and plan sponsors want out of a health plan. Yeah,
and so I was referring almost exclusively to the network piece when I was talking. I think if you expand it to kind of owning the healthcare provider and the PBM designs, again, they were designed in a way where they're working perfectly for those that designed it that way.
Exactly.
Right? It's perfectly designed for the results that we see today. What's happening is people are recognizing those are not the results we want anymore.
Yeah.
And so yes, I think that is clearly where the hostility potentially in the umbrage that you describe is coming from. But again, it was designed a certain way to operate a certain way, and we've allowed that to happen.
Well, and I think what ultimately what it comes down to is what I just described a moment ago, is creating a better alternative system, not sort of fighting the existing system like you're talking about, but creating a better version of that. And over time, I'm sure that will continue to evolve. The VālenzONE will continue to evolve. But a piece that we haven't really talked about, Rob, is pharmacy benefit management, which is the thing that everybody wants to scream about right now. So where does that come into the fold with you? Are you guys flexible with the partners, or are you bringing solutions to the table there too?
Yeah, so pharmacy is a place where we have, I'm going to say, taken our time.
Okay.
Right. So we have a 340B option or solution that can help drive reduced expense in that category, and it's a wonderful program. We're not a PBM. We'll partner with PBMs. We'll work with PBMs to create greater transparency and greater cost reduction and greater integration of data. That is a place where we are spending time now trying to figure out what the next generation looks like. And I think pharmacy specifically, not just PBM, but the entire sector of what, with the high cost drugs and the alternative distribution, cell and gene therapy, GLP-1s, it's messy. It's not, again, you got to unpack it and step back. There's a lot more going on. I'm not an expert in pharmacy. That is not my category, right? That is not my swim lane. But I have a PharmD on staff who is, and we have a group that's working on this today. And so we will figure it out. We'll have something that we've spilled milk inside of to get to the outcome that needs to happen here in that integration and philosophy. But pharmacy is messy.
Yeah, it is.
And how do you, so this is where stop loss, it's really an interesting conversation, because this is where we don't talk about stop loss enough. You and I talked about this a little bit earlier, but I'm going to pivot pharmacy back to stop loss, because if you look at the greatest cost and the greatest influence on a stop loss program, it is, can you get pharmacy under control, right? For those things that cell and gene therapy, GLP-1s, other biologics, everything that's happening in the space. And so this is where, and your analogy earlier about adding all these other services into your mortgage, right? I think that's, and your insurance rather, is really interesting. I'm looking at what we're doing as an opportunity to think about it almost like home buying or car buying, but I'll use home because I think it's more relatable. You're not allowed to go really look for a house until you get approved for a mortgage. Right. Somebody's got to tell you, hey, this is what you can afford, or this is what we're going to approve you to go buy. So then you got to figure out how you're going to alternatively fund if you want something bigger, right? So if you're approved for a $500,000 mortgage and you want to buy an $800,000 home and you have to have 20% down, you got to come up with another $130,000 somewhere in order to keep the mortgage. I think stop loss has been treated like, oh, I'm going to buy the house and then go get approved for the mortgage.
Okay.
Like, it doesn't make sense to me. Like, logically, stop loss is a financing option. And so plan design, the components of plan that drive expense that you can control, and then stop loss giving you benefit for that, critically important. Stop loss knows all the claim information, right? They're doing claim underwriting. So why don't we start with what's driving the cost of your program? Stop loss is going to be able to tell you that, right? They're going to see all the claims. They know everything that's going on. So let's start with what areas of those claims do we want to attack? Can we do that in plan design? Can we do that in the cost containment solutions that are going to drive the plan design options to reduce that spend? And then how do I account for that in the math of your stop loss? How do I help you think about your deductible, right? This whole idea of an SIR, and where do I attach, and what is going to be my spec and my ag? Maybe I can move it if I do things differently. Maybe I can help think about financing a bigger house, right? By doing more on my own. So I just look at it as, that's how we're looking at VālenzONE, is it's kind of it's a three-legged stool. It's all the cost containment, it's the design and integration of the plan itself with the network components and the care components and the clinical components, the member engagement and experience components. It's understanding how you're underwriting that in the plan design to allow you to take advantage of what you have available to the member, and then stop loss financing it for you and saying, hey, you do that, we can do this for your mortgage.
And I love that too. And a lot of people don't really, they forget. They know, but they forget. Stop loss is a function of the risk profile, the risk history of the group, and the projected risk in the future. And so if you do a better job of improving the risk profile and the prediction of what those outcomes are going to be in the future, your stop loss will follow suit. But a lot of consultants, I'll find, get obsessed with the pricing in a few points here, a few points there. Hey, you're hosing us or whatever. And the reality is a stop loss carrier has to price for what happened in the past, what we think is going to happen this year, and then if we're going to renew it, what is possibly going to happen in the future, and how does the risk profile of the group change over time?
That's exactly right.
And if you spent more time as a consultant or somebody that's alongside the employer thinking, how do we drive down your risk? Not your risk financing, but how do we drive down your risk? Your risk financing will follow suit.
And so it's fascinating. So I think I shared with you earlier, 23 plus years in the property and casualty space. Principally in workers' compensation, managed care, cost containment. Risk management was the prioritization thought process. Like everything in P&C is around risk mitigation, risk management. I made the assumption it would be 10 times more prominent in commercial group health.
Yeah.
And I have yet, if 6 years in, I have yet to have somebody start with, we got to do a better job of managing our risk.
Yeah.
And so part of VālenzONE is also acknowledging, while I haven't said it's a risk management design, if you think of the philosophical approach, I'm creating a risk management model.
Yeah.
I'm saying, let's be smart about what risks you can control and you can't, which ones do you want to pay for, which ones don't you want to pay for, and then how do you want to finance that?
Yep.
That's risk management.
That is risk management. And it's just like, it's turning dials on. If you had, like Nathaniel has a soundboard and he's turning dials and tweaking different things. If risk management is turning dials here, or turning this one down, turning this one up, and the stop loss will go, and it'll follow suit with how you're turning those dials. And then you want a partner like, Certus is now, is it still Certus? Or
it's Vālenz stop loss.
Vālenz stop loss. Vālenz stop loss is there to say, okay, as you've turned those dials, here's what we're comfortable pricing your risk financing at. And you tell us if this is appropriate, or do you want to tweak your risk management a little bit more to get here or get there? Or do you want to take on more risk yourself? Or do you want to push more to the stop loss entity? It's a constant sort of art of moving those dials upwards and downwards.
100%. And to your question, so we've gone through a brand unification process over the last, say, 6 to 12. We still have a little ways to go where the strength of our company, the strength of our relationships are going to be fundamentally better when we're one brand, Vālenz. So Vālenz Health and Vālenz Blue Book, which will be a subset inside of Vālenz Health, but everything is Vālenz now. So Vālenz Stop Loss, our clinical and care solutions are going to be labeled under a Vālenz moniker of NavCare and Precision Care Solutions. And so we're going through a whole naming reconvention or nomenclature to try and improve the strength and visibility of all that Vālenz does.
Yeah.
As one product suite.
Having spent years working alongside healthcare leaders, brokers, and employers, I know how overwhelming healthcare can feel for our customers. We've all been there. Those renewal conversations that never seem to get easier. Rising pharmacy costs and medical costs, and no real transparency into where healthcare dollars are going. That's why I'm excited about Nomi Health. They're not just fixing the old system. They've rebuilt self-funded benefits from the ground up. With Nomi's network, you can offer something truly different. No copays, no deductibles, zero out-of-pocket costs when members see a provider. It's the kind of benefit that makes everyone ask, why hasn't healthcare always worked this way? Ready to bring your clients something different? Visit nomihealth.com and see how Nomi is rebuilding healthcare, one employer and one community at a time. I love that. And I mean, ultimately, the idea is to attract folks that want to buy into the philosophy and what you're trying to get to in terms of healthcare evolution. And Vālenz can be that partner that can bring you alongside and collaborate on that journey as well. And I think making it a lot more cohesive and simplified in the way that you brand it is a strong part of that.
It is. And there's this tendency to say, well, that person is a competitor, or that business is a competitor, so I shouldn't work with them. I need to hold. And the reality is, we can be frenemies, right? I didn't create frenemies, but the whole idea is, as long as I stay in my swim lane and you stay in yours, there is some level of overlap, but there is a union benefit of us coming together where we can solve problems that we couldn't do on our own. So we're exploring being Switzerland in this space and saying, whoever wants to talk to us, we're open to it. And maybe we're going to compete in certain categories. I'm going to build a trusting relationship where I'm not worried about that, because there's greater value in working together in these areas than the risk of you trying to take from me and others. And I feel like that's also missing in our space today. It's you're one or the other, not both.
I couldn't agree more. I was at a conference not too long ago, and I was talking to a gentleman at a competitor, right? Had a friendly conversation, joined the conversation with him about the conference, about just him personally. And one of his colleagues came up to him later and goes, "What are you doing talking to that Pareto guy?" And I never once had any concern that I was talking to a competitor, because my sentiment is that we might do things slightly differently in the way that we solve the problem, but I believe both organizations have the similar goal in mind, which is improving the experience for the employer and the member through financing it better and creating better structure. Sometimes theirs is preferred, sometimes ours is preferred. In situations where we're directly competing, I hope our team wins, but that doesn't mean I want them to fail or I treat them like an enemy.
I've used this analogy probably for the better part of 20 years, because people are always afraid to give details about what they do in their business.
Yeah.
And I'm unafraid to tell everybody what we're doing every day.
Yeah.
But I could care less. Like, you should know, I'm going to be transparent. And I used Coca-Cola as an example. Pick up a can of Coca-Cola. Every ingredient is on the can.
Yeah.
Nobody else has created Coca-Cola.
Yeah.
It's not what you do, it's how you do it that matters. There's plenty of companies like Vālenz that are top-notch and do a lot of stuff like we do. They don't do it the way that we do it. They're going to do it their way. And I'm cool with that. And I think the market needs to be cool with that. That's why some people choose Pepsi. Right? That's why some people choose Sprite, because they don't like cola. So but Coke put their label on their can and gave you everything that's in it. Go make it. Good luck.
Good luck, because you don't know the exact formula,
Yeah,
right?
I'll give you all the ingredients.
Yeah, good luck.
I'll give you all the ingredients. Once the cake is baked, let's see who's better.
Yeah.
Right?
You know what is
prefer.
the differentiator in a lot of the situations where both products serve the same purpose? The relationship. It's the people that work at that
Every day.
organization. Yeah, it really is.
And so that's a great place maybe to go, is we have a people strategy.
Yeah.
Right? We want people in our company to embrace the philosophy, to embrace the imperatives and the values, and principally the foundational four. I want all of our employees to wake up every day with a sense of purpose, with a sense of pride in the brand. It's why we have so much branded merchandise. Is I mean, I get emails from companies from employees that say, "I just saw the Vālenz Blue Book hat you were on I haven't seen, is that on the company store? Can I go get it?" I'm like, "Give me your address. I'll find a way to ship one to you."
Yeah.
If you want to wear something with Vālenz, I'm going to give it to you.
Yeah.
And so many people have pride in the brand, and we want people like that. We want people to really feel like they're making a difference, right? We are not a philanthropic business. We do have a communities give back program. We contribute, we participate, we do food pantry, we do volunteer days, we give employees off for paid volunteer time each year, and we want them to be out in the communities that we serve. But we're a for-profit business. But that doesn't mean that we can't be doing good the right way, and that's what we want our employees to feel good about.
Yeah.
And so you're spot on. I want people to choose to work with Vālenz because we satisfy their needs from a business perspective, but they love working with our people.
Yeah. When I was telling you, as I was observing you talking about your brand, and I know we'll probably wrap things up on this episode and do what we're going to do next, but I don't suspect you have difficulty attracting top talent to the brand as it currently sits. I think your everything from the color palette to the verbiage to your mission statement to you as a person, I view this as an attractive place for people to aspire to be to.
Yeah, I'm humbled by that every day, actually. I'm shocked at how many people reach out to me and say, if you're ever looking for someone in this category, I'd love to come explore and work for you. I hear nothing but amazing things about your company. And again, you go back to that innovative comment earlier, like, does that make you change? No, it just makes me more motivated to do it exactly the same way, to treat people fairly, to have honest conversations, to have a yes and approach, to allow people the freedom. I have a phrase called room to roam.
Room to roam, okay.
We have calls that probably we could finish in 15 minutes, but we set them up for 45. And so we have room to roam in the conversation. We want people to have room to roam in their day to figure out what else is going on around the company. And I feel like it's that Richard Branson, and I'll never get it right, I said it to you earlier, train people so they can work anywhere, treat people so they won't work anywhere else. And I really believe that. And it's not just about me. It's about my executive team. They are all committed to this. They love this place. We have hard days. We have hard conversations. We have what we call Rich Dialogue Mondays. We have a call, Rich Dialogue. And the success of a company is predicated on this idea of having really open, honest conversations. So we have really open, honest, rich dialogue conversations as an executive team. What are we doing? What can we do better? What are we missing? And I just feel like, I can't spend enough time. And look, I've given Karen credit for so many things here. I might as well just do it one more time here. Her background in organizational development, her master's in this category, which is all about people and the safety and the psychological safety of a company, that resonated with me. She helped me understand when you're putting things together, it's got to be in an environment where people feel incredibly safe and incredibly connected. And that's what we've done.
Yeah.
That's what we've done. We've leveraged what she helped me understand, and then we've broadened it across a business now of almost 600 people.
Yeah, I didn't realize you guys were that big. That's astonishing. Well, so let's kind of wrap this for here, Rob, and then we'll go, like I said, go on to our next shoot. We've covered, hopefully the folks have watched the walk around, the loop that we took through Vālenz headquarters. We've told the story of past, present, and future for Vālenz. And so as we wrap this segment up, what is maybe one or two things that you want people to think about your company or what we discussed before they go about their day?
Yeah, I'm going to go back to maybe something we talked about, Back to the Future, which is I want people to see us as a business that is solving problems, that is meeting the moment in your unmet and underserved needs. I want people to think of us as a community, as a culture community, where we're willing to explore and recognize we don't have all the answers, but we want to hear the questions. We want to understand what's needed to make this healthcare segment, sector, industry better. We believe that we can make it better than it was when we got here. And we need partners to help us do that, right? And we need partners that are willing to go on this journey of making mistakes with us.
Yeah.
Because innovation happens by getting it wrong first.
Yeah.
We talked about that multiple times today. But, if you look at anything that's progress, that was a big, hairy, audacious goal, it didn't get done the first time the right way. And then even as it was successful, it was manifesting and modifying as it went to be relevant on an ongoing basis.
Well, I'm thinking about, just as we wrap it up and close the loop here, what you're looking for is partners that are willing to get comfortable being uncomfortable.
Yes.
That can spill some milk alongside of you and not scream and hem and haw. And then ultimately that will say yes and to this collaborative shared goal, right? And that's
100%.
That's the kind of best way I could think to close the loop here. And it's been such a pleasure. I know we're not done for the day, but for the sake of this episode, just want to thank you again for having us here in Philadelphia, man.
This is amazing.
Yeah,
Appreciate
likewise.
you. Appreciate everything that you do.
My pleasure.
Thanks.